Okay, everyone, I'm so sorry that you guys were not able to come to the lab the other night, but I'll do the best I can. So when you come in, your charts will be here in the chart room. There are telephones for you to grab. You'll grab a badge if you're charge nurse or whatever. We have notes or charts rather for the patient, the baby, pediatrics. So all your charts will be here. This is our board. And so if we were to have a code or neonatal resuscitation or anything like that, major anything, we use this board to document. We have our frequent vital signs there. This is our linen. Also, extra supplies are found here. So this is right after you have passed the scale. And so all your extra supplies and your linen is here. Scale is there. If you need an EKG machine, it's there. Then we move on to the counter, and there you have all of your gloves. So when you come in, you guys, because this is a clinical, we're going to act like it's a clinical. So no need to tell me I would wash my hands. I will put on gloves. My expectation is for you to do hand hygiene and gloves if it's necessary. So there's your scale. If we have a postpartum hemorrhage, we can weigh the blood. If we have a newborn, we can weigh the newborn. You have the OR, so all of your OR hats, gowns and gloves, your instruments, if you need anything for your OR, is there. Extra supplies for post-op patient, bandages, incentive spirometers, if you had to do a dressing change, anything like that. And then all of your newborn supplies, including gloves, are here. I do have here the chart. So here's your prenatal record, your ACOG form, has everything on your patient. You can see that tomorrow. And then here's your chart, has your patient information, has physician orders, what else? Nurses' notes, different things, your MAR. And so when we do our labor, delivery, recovery, postpartum, this is the chart you will be using. For tomorrow, we will be doing the antenatal record or your ACOG form. This is a wheel that you can use for our estimated date of delivery. We have policies here on the counter. So policies, procedures, we use them, of course, throughout nursing. This is an important station right by the counter. It is the medication station. So all of your medications that you'll be given are here. Your syringes, Band-Aids, alcohol, things like that are there. And then we have the postpartum hemorrhage slash crash cart. So all your IV fluids, if you needed to hang IV fluids or there, Pitocin, that kind of thing. Here's insulin syringes, medication cups, cure sets for your IV start kit. Here is the lab. And so anything you would need, GBS swabs, specimen cups, urine dip, any of those things, actual lab tubes, vacutainers. Then this is our IV or oxygen station. If we need to intubate our patient or emergency rescue with breathing, nasal cannula, rebreather mask, that sort of thing. Epi. Then this is the postpartum hemorrhage kit or drawer. If you needed to give blood, if you needed to have your normal saline, set up blood, you would do all of that from here. We have a pressure bag in case you need to give fluid really quickly. Then we go over to the newborn. And so the NICU, we have our baby here. We can resuscitate our baby. Also, we have NRP and APGAR scoring. So if you needed a little cheat sheet, you could use it. We can turn on our warmer. There's our baby. Everything is there to do our neonatal resuscitation. On your drawers, you have bulb syringe, extra blanket, tape measurer, the baby bands, the alert, code alert, everything you would need for delivery. Here's your emergency if you need to do a blood sugar, start an IV on the baby. If you needed to give medications, we have epi if you need to resuscitate. And then extra, if you need anything extra, it's in that lower drawer. This is pediatrics. So that is our baby as a 6-year-old. This is a little toy box. There's a crib for our baby. We have another scale. We have IV fluids if we need, and multiple IV stands. We have our postpartum patient. We have our OB patient, Pamela Anderson. You'll meet her tomorrow. So here is her fetal monitor. See, the fetal monitor parts are in it in the paper. Here's her IV pump if she needs it. We can do we can do fetal monitoring as well as pulse ox for this patient. She has an ambu bag if we need it. She has suction as well, blood pressure cuff. We can use oxygen if we need to. When you get ready to do labor and delivery and all of those things, you will be setting up the room from scratch. I just have it set up so you can see. We have fetal monitor belts. We have parts for the fetal monitor. And remember, the ultrasound is the one with the flat. The button is the one for the contractions. There's little Pam Anderson. If you need to do any kind of exam, you have speculum, group beta strep swab. Here is a picture of, or an example of a suction and forceps, and this is a curettage. So this is what we use for a DNC. And you can see how it scrapes the uterus. Here are some more things that we use in labor and delivery. This is an internal monitoring. So if we need to do internal monitoring, of course we have sterile gloves there. If we needed to do a fetal electrode, this is an internal monitoring. This goes onto the baby's head, and then we can remove the external fetal monitoring. Here's everything to check your patient. We have a DTR hammer, a light, gel, Doppler, tape measure. For our labor patient, she has a drawer where you have chucks, gloves, emergency equipment if we need it. Stethoscope, but everybody should, if you're doing an assessment tomorrow, you should be bringing your own stethoscope, of course. We have a little guide that will tell us how to visualize the opening of the cervix, so you'll be able to see that tomorrow. And I think that is about it. So sorry you guys weren't able to come in and do this, but this was the next best thing. So I will see you tomorrow. Make sure you read your canvas, and we'll do our paperwork at the end of the shift. Thank you.